Move on to Dr. Padmaja A. Shenoy, who's an associate professor of microbiology at Kasturba Medical College, Manipal. She's MD microbiology and has more than 14 years of diagnostic experience in the field of clinical microbiology with special interest in anaerobic infections and AMR in anaerobes. She has received research grant from Indian Council of Medical Research, Central Indian Institute of Medical Sciences, Nagpur, Manipal Center for Infectious Disease, Wellboim Probiotics Limited, and Mahe Manipal for performing research project. Dr. Padmaja has authored over 58 publications in various national and international journals with primary focus on anaerobes and the implications for medical community. She is one of the editors of the textbook Anaerobes of Clinical Significance, published by Cambridge Scholar Publications, UK. She has authored more than 4 book chapters. She delivered several guest lectures and presented scientific papers at various national and international conferences in the field of anaerobic bacteriology. Two of her best authored research papers have got gold medal for outstanding research publications during the college day celebrations. Dr. Padmaja will speak about anaerobic cocci. Dr.
Yes, sir. At the outset, I would like to thank Dr. Ashok Rattan and Kaho team and Dr. Rama Chaudhary for giving me this opportunity for being the part of this webinar. Today, I'll be talking on anaerobic cocci of clinical importance. So when we talk about anaerobic cocci, so anaerobic cocci consists of gram-positive anaerobic cocci and gram-negative anaerobic cocci. In my today's presentation, I'll be concentrating on gram-positive anaerobic cocci. So just like any other anaerobic organism, anaerobic cocci are also a part of normal flora of skin and mucosal surfaces of the oral cavity, upper respiratory tract, etc. So gram-positive anaerobic cocci constitute about 25 to 30% of all the anaerobic bacteria isolated from clinical specimens. So when we have diverse clinical specimens, so bacteroid species are number 1 among all the clinical, anaerobic isolates, followed by gram-positive anaerobic cocci. So these tiny creatures are often, it will get missed or underreported, and these organisms are commonly encountered in deep-seated abscesses, bone and joint infections, intra-abdominal infections, and infections of the female genital tract and bacteremia. So these organisms are often seen as a part of polymicrobial infection. To understand better, let us begin with a case. Next slide, please. Here is a case. Next. So where a 25-year-old male presented to our OPD with the complaints of wound over the dorsum of the left foot for past 2 years. So if you see the first picture, you can see a oval ulcer on the dorsum of the foot, and you can also see the sequestrated bone with the irregular margins which are visible. And the X-ray is showing us there is lysis of the head of the second metatarsal. Next, please. So this patient was clinically diagnosed as a case of chronic osteomyelitis of first and second metatarsal of the left foot. He was taken up for the surgery where sequestrectomy and debridement was performed. Next. Following sequestrectomy and wound debridement, the samples like bone and sequestrum were collected in sterile container for aerobic culture. Next, please. Next, please. And for anaerobic culture, the same samples were inoculated in RCM. So what is RCM? Robertson cooked meat broth. Next, please. So once the sample arrived in microbiology lab, we did a gram stain. So gram stain showed presence of gram-positive numerous pustules with gram-positive cocci and gram-negative bacilli. Next, please. Aerobic culture showed the evidence of Streptococcus pyogenes and Pseudomonas aeruginosa, and the sample which was cultured on anaerobic blood agar. Next, please. Anaerobic blood agar showed. Next, please. The anaerobic blood agar showed the presence of Peptostreptococcus anaerobius. So what is this Peptostreptococcus anaerobius? So Gram stain highlighted, previous slide please. So Gram stain highlighted the presence of both gram positive and gram negative organism. But when in the culture, if you see, aerobic culture showed the growth of Streptococcus pyogenes, which is again an aerobic streptococci, and anaerobic streptococci in anaerobic culture. So if you see the plate down on the anaerobic culture, so what we have used is anaerobic blood agar. So anaerobic blood agar, whenever you are processing the sample for anaerobic infection, we have a policy of putting, the metronidazole disc. You can see a disc called as M there, okay? So which is put right diagonally opposite to the well inoculum or the primary inoculum. So there is a saying that most of the anaerobic organisms are presumptively susceptible to metronidazole. So if you see the picture, at the end of the last streak lines, you can see some tiny colonies, like white colonies, which are not growing near the disc. So these are the anaerobic organisms, so which we further process for gram stain, and we process with the genus level identification using the special potency disc and confirm the identification with the help of Malditov. So this is what I meant to say, polymicrobial infections. Next slide, please. So when we talk about gram positive anaerobic cocci, so we have they belong to a family Peptostreptococcaceae and the phylum Firmicutes. So this name I'm sure you all would have heard Firmicutes in many of the genome sequencing papers also, right? So this Peptostreptococcus, the genera Peptostreptococcus, the commonest organism is Peptostreptococcus anaerobius, Parvimonas micra, and Feingoldea magna. Then we also have other genera like Peptoniphilus, which consists of Peptoniphilus asaccharolyticus, Anaerococcus, which consists of Anaerococcus prevoti. So there are many other organisms also which are falling under the family Peptostreptococcaceae. There are some newly found organisms like Anaerococcus mordecai, Peptoniphilus gorbecki, etc. Next slide, please. In the recent years, we have come across lot of reclassification and newer nomenclatures we have seen in most of the anaerobic organisms, even in the bacteroides also. But in today's presentation, I will be just stressing on gram-positive anaerobic cocci. So where the previous name has been highlighted on the left side and the current name has been highlighted in the other side of the table. So this Feingoldea magna was previously called as Peptostreptococcus magnus, and similarly Parvimonas micra was previously called as Micromonas micros. So similarly, so many other organisms also we can see here in this table. Next slide, please. What is the clinical significance of this GPACs? As I mentioned in my first slide, so they are part of normal flora. So whenever there is some breach in the normal continuity of the mucosa or the skin lining, so the same normal flora act as an opportunistic organism and try to cause the infection. So these gram-positive anaerobic cocci are, it consists of different organisms like Parvimonas micra. It has been well known to cause, oral infections like periodontitis. It's an oral pathogen, endoperiodontal infection, apical infection, etc. So these organisms have also been isolated from abdominal abscesses and post-operative wound infections also. So this plates on the down part of the slide are showing, like you can see here on the corner of the slide, you can see one plate where the aerobic organisms are growing next to the metronidazole disc, whereas there is clear inhibition, what you can see on the part of anaerobic organism. So you can see a zone of inhibition near the disc. Next slide, please. So Peptostreptococcus anaerobius. So this is the most important organism among different gram-positive anaerobic cocci. They're found in polymicrobial infections, and these are the gram-positive cocci which are present in short chain and can be identified with the help of a special disc. Can you see in the picture SPS? That is the sodium tauroamethol sulfate disc. Okay, so this disk will help us in identification of only this particular organism among all GPACs, what I had listed earlier. So this organism is known to be, from the different cultures, there are isolation rates ranges from 6 to 7%. So this has been implicated from different infections like abscesses in the brain, pleural cavity, urogenital infections, or abdominal infection. So certain papers are also highlighting there is some, association between the, the organism Streptococcus anaerobius with the infection below the diaphragm, especially from female genital tract infection or genitourinary system. Next slide, please. Now coming to Feingoldea magna. Why is this organism deserves attention? So you would have heard Staphylococcus aureus in aerobic organisms, right? So it's the same like Staphylococcus aureus. We have among the anaerobic organism Feingoldea magna. So this Feingoldea magna is discovered by Sir S.M. Feingold, who is also called as Mr. Anaero. So he is an American microbiologist. So this organism often present in tetrads or clusters, and it is a slow grower. Slow grower means it takes at least 2 to 5 days to appear in the culture. So this is the most virulent of the anaerobic coccus, causes recurrent infection, device-associated infection, and there is strong tissue adherence and biofilm formation. Why is this happening? It's all because of the different virulence factors which are expressed by these organisms like protein L, peptostreptococcal albumin binding protein, and etc. So to understand better, I will take you through another case. Next slide, please. Okay, so here is a case of 61-year-old man who came to our hospital with a history of painful swelling in the left breast for 10 days, which was associated with non-radiating throbbing pain and foul-smelling discharge. So you can imagine he's a male patient coming with the history of painful swelling in the left breast. So what clinicians thought initially, because when they asked the history, there was no history of fever, trauma, smoking, probiotic intake, or dental interventions, etc. So only there was history of painful swelling and some foul-smelling discharge. So only history what clinicians can elicit was he was a diabetic, but his diabetic condition was not under control. So past like 4 years back, the patient also told that he had similar symptoms 4 years back, but he was treated with antibiotics and it got resolved. But the information was not known to them. At this stage, clinician thought it could be a case of malignancy because it is very unlikely to have abscess in a male patient. Next slide, please. So when the local examination was done, clinicians could see that the swelling was tender, it was fluctuant, and there was, it was present in the inner quadrant of the left breast. So the skin over the swelling was warm erythematous. So when we did the lab parameters, his counts were normal, but only thing his diabetic state was not under control with the HbA1c of 9.7%. Next slide, please. So with this, at this stage, they started the patient on oral metronidazole and amoxicillin clavulanic acid. So incision, he was taken up for incision and drainage of the abscess, and here 20 to 25 ml of the foul-smelling pus was collected from the abscess, and it was sent for histopathology to see whether it is really abscess or some malignancy which is hiding inside, and it was sent for microbiological workup. So when we did the gram stain, we could see numerous pus cells and some gram-positive cocci in pairs and tetrads. Sorry, here the gram stain, like it is very difficult to capture the gram stain pictures of anaerobes because they're faintly stained most of the time. But you can clearly see in this picture, these organisms are arranged in tetrads and some places clusters. So when we did the anaerobic culture, we could see two types of organism. One was growing next to the metronidazole disc, but the other one was growing away from the metronidazole disc. And these two organisms were found to be, we confirmed it with the help of Malditov as Feingoldea magna. So, and other organism was Bifidobacterium scardavi, so which is known to be a probiotic, organism of probiotic importance. So, next slide, please. At this stage, again, the patient was like his sugars were under control and he was discharged. And you can see the post-op day 10, post-op day 10, day 10 ka picture also. The wound is almost hid. So he was discharged with oral metro and amoxicillin clavulanic acid for 10 days. And he came up for the follow-up visit also, which was uneventful. Next, please. Next slide, please. So this we had published in Anaerobic Journal in the year 2022. Next slide, please. So next, please. No, previous slide. So not only breast abscess, which is a rare cause like what we had encountered in our setup, this organism has been even isolated from prosthetic joint infections, orthopedic infections, even from cases of endocarditis. So this organism has some spotlight on it. So next, please. Next. So this is a systematic review of brain abscesses which is caused by anaerobic microorganisms. Next. So here you can see there are around 28 studies they had included. The commonest organism isolated was bacteroides species, followed by gram-positive anaerobic cocci, of which next the Peptostreptococcus anaerobius and Parvimonas micra was the commonest organism. Next, please. What is this Parvimonas micra? So this Parvimonas micra is gaining a lot of importance these days. So this has been associated with, commonly associated with nosocomial and those patients who are coming with immunocompromised state. So it's also associated with chronic periodontal infections, alveolar abscesses, CSOM, etc. So this pathogenicity of P. micra is attributed to the presence of its capsid and high protease activity, and it's often involved in deep-seated infections and prosthetic joint infections. Next slide. So we also came across one case of septic arthritis where the patient, had knee swelling and the knee joint fluid, synovial fluid was collected and sent for aerobic and anaerobic culture. Gram stain had the evidence of gram-positive cocci and gram-negative bacilli. Aerobic cultures were consistently negative, but we could isolate Parvimonas micra and Fusobacterium nucleatum from this case. So this we had published in 2018. Next slide, please. So when we talk about antimicrobial susceptibility testing, for aerobic organisms, we have established disk diffusion method and Vitek system, which will give you the result within 24 hours. For anaerobic organism, it is not so. So we don't have, recently UCAST has come up with the disk diffusion method, but if you see, they have highlighted only Bacteroides, Prevotella, Fusobacterium, Clostridium, and Cutibacterium acnes, but GPACs are not coming under this headline. So we are dependent on agar dilution. Next, please. Agar dilution and e-test method. Okay, so these two are the methods which are dependent. We are dependent on determining the MICs of the anaerobic organ. Next slide. So the recent years, we have come across a lot of rise in the antimicrobial resistance among anaerobes. But when I looked at the literatures, lot of papers are there on bacteroides species, but very few I could find on gram-positive anaerobic cocci. So if you see, the anaerobic antimicrobial resistance is not same across the globe. It varies from place to place, region to region, species to species, organism to organism. So if you see, there were no microdazole resistance in France, but in Spain they have come across around 15% of resistance among Feingoldia magna, and in Italy in 2023 they have come across around 18.2% of metronidazole resistant. Similarly, if you compare with the metronidazole resistant, clindamycin resistant rates are quite higher. Okay, so clindamycin can no longer be considered as empirical antibiotic of choice for if you are considering anaerobic infection, because there is a lot of increase in clindamycin resistance rather than metronidazole resistant. So the second table is highlighting you the different clindamycin resistance rates across the globe. Next slide, please. So as I'm talking about gram-positive anaerobic cocci, so I thought of including even penicillin resistant, which is beta-lactam resistant. So there are studies which they have come across a higher, penicillin resistance among P. anaerobius in their setup also. But when you look at the Indian data, like we had conducted one study on P. anaerobius where we have not come across any metronidazole resistant, but our clindamycin resistance was around 50%. And similarly, in 2023, we had conducted a study on F. magna. Again, metronidazole resistance was not seen in our setup, but clindamycin resistance was 9.5%. But a study conducted in Chandigarh by Dr. Archana, so they have come across overall antimicrobial resistance was around, metronidazole resistance was around 31%, and clindamycin resistance was around 42%. Next slide, please. So when we talk about anaerobic infection, collecting the right sample at the right time, avoiding the contamination with the normal flora is very essential. So that's why your sample, what you're collecting for the diagnosis, should meet the acceptable criteria. So this is the acceptable criteria. These are the different samples from the different infection. Next slide, please. So these are the unacceptable samples. Swabs never be expected, you can include, and even the stool sample, unless and until it is asked for C. difficile culture, should never be processed for anaerobic culture. Next slide, please. So these are the different, containers, like you can make use of sterile container, but make sure that you transport the sample within 20 minutes to the lab, avoiding exposure to the oxygen, or you can collect the sample in RCM broth. We also have, in our setup, if there is some pure pus which is present in the patient sample, we ask the clinician to inoculate in the Bacti bottle. There is one anaerobic Bacti bottle which is available. Directly, you can inoculate the pus sample into the Bacti bottle also. So down part, you can see different commercial media, but as resource limited country like India, we cannot afford to buy so many, expensive commercial media. Next slide, please. So when you get the sample, you have to process the sample on anaerobic blood agar, phenyl ethyl alcohol agar, or neomycin blood agar. Anaerobic blood agar, neomycin blood agar are very good, and you can isolate most of the anaerobic organism from your patient sample. Make sure that you follow strict anaerobic atmosphere, either with the help of gas pack jar or anaerobic workstation. You have different biochemical reaction. Next slide, please. So this is the flow chart which is highlighting. You can use, I had shown you SPS disc. So that was sensitive only for P. anaerobius, right? So, and there are so many other biochemicals like indole or, phosphatase, alkaline phosphatase, etc., where you can come down to the genus level and species level identification of anaerobe. But the best thing to identify anaerobes is with the help of Moderator. Next slide. So if I take you back to the cases, the first place I discussed about polymicrobial infections. Whenever you have a bone which is not healing, think of mixed flora and start the patient, do the surgical debridement and start the patient on organism directed therapy, and that will help you in recovery of the patient. And second case was a recurrent abscess, negative aerobic culture. Think of anaerobe. Okay. So often you think it could be a case of malignancy, but it is not so. Rule out anaerobic infection first before you consider malignancy as your differential diagnosis. Next slide, please. One thing I want to highlight at the end of my presentation, if you don't look, you will not find it. It will remain underdetected. Any persistent recurrent infection, consider anaerobes. Always think of collecting proper sample, acceptable sample, and put it on a right culture media with always put a metronidazole disc in the culture plate. And also source control is not negotiable. But if you see my two cases, both cases there were like surgical debridement and incision drainage was done. So source control is very essential, and know your local AST. Based on that, prescribe the antimicrobials. And there are some modern diagnostics also which will help you in identification of novel anaerobic organisms like 16S. Thank you. Thank you for this opportunity.
Thank you very much, Dr. Shenoy. It was very well explained.